Hi, my name is Jerome Bronson. I am a Doctor of Public Health candidate at Jackson State University, an HBCU that is located in Jackson, Mississippi. The past 2 years, I've had an opportunity to conduct biomedical research with the Jackson Heart Study, which is the largest single site longitudinal study of cardiovascular disease in the African American population. Uh, Gaining this opportunity to conduct biomedical research, it really opened my eyes to the disproportionate uh, representation that Black and Brown people have in biomedical research, and it also shows that there is a direct correlation between health disparities and racism as a public health crisis. What led me to wanting to study in the field of public health was just growing up in an underserved community in Mississippi and seeing the poor health outcomes of those in my community. It really sparked an interest of wanting to use my voice and use my platform to improve the health outcomes for those in my community and really educating those on what they could do to improve the health outcomes for their families and for our community as a whole. I think the one thing that really surprised me uh, during my studies in the field of public health was the release of the Heckler Report in 1985 by the United States government, which was the first time that we really began to understand that prior to 1985, the United States government didn't even, there was not even a cause of death that was located on the death certificate of African Americans in the United States. So the release of the Heckler Report really was the beginning of focus being placed on research of diseases of the African American population. So that was surprising that that was less than 40 years ago that here in the United States that there were not even viable data and statistics being recorded on the African American population, which really allowed me to really understand that there is a huge gap and the quality of data that is available and the quality or the lack or the gap in literature that is even available to study the chronic diseases and in the black and brown communities here in America. That really was mind blowing that we are still in the infancy stage of doing biomedical research on minority populations here in in America.